Hi, my name is Jordan Stenzel, and I'm your health educator that's going to go over the suicide rate among youth adolescent females. The public health issue is the increasing rate of suicide attempts and completions among the adolescent female population. More specifically, the 10 to 24 years of age female population that are impacted the most by suicide. The Centers for Disease Control and Prevention found that suicide rates have tripled in females ages 10 to 14 years between 2009 and 2015. The CDC compared data from the year 2000 and 2016 on the suicide rates for females in this age group and saw that the death rate due to suicide increased from 0.6 to 1.7. This is an alarming statistic that shows the need for careful examination of this public health issue. According to the CDC, suicide in adolescent female may be caused in part by the following: puberty-based hormonal and physical changes, undiagnosed mental health issues, prescription drugs for depression, and increases in substance abuse and alcohol, which can be a major factor. Here is the social ecological model of the issue. At the individual level, the adolescent female's own self-knowledge of the issue and what they should do if they feel depressed, emotional, or suicidal, and their willingness to get help from a family member or a healthcare professional is paramount. At the interpersonal level, you have parental interest in this subject, as well as support from both medical and mental health providers. At the organizational level, organizations like the National Suicide Prevention Lifeline offer 24-hour support and counseling to those who feel suicidal across the country. Then there is the community level. This would include community-based suicide prevention coalitions, as well as the community-based beliefs and stigma about how to treat mental health issues like suicide. Lastly, policy at the local and state levels are just as important because policymakers can come together to create public policies which enforce trainings, educations, and self-help to address suicide in the youth adolescent population. So how do we deal with this public health issue? Well, we have some proposed interventions which are based on evidence. The first one is the FACT screening tool, which stands for Feelings, Actions, Changes, Threats, and Situations. This training tool is designed to offer just a basic awareness to identify the warning signs of suicidal ideation, typically not for those who are trained classically as a mental health provider. So this would be geared toward parents, teachers, and those in the community that are interested. The next is a crisis safety plan. This is a tool created between the adolescent female and their primary care provider or their mental health provider, which are trained in order to ask the right questions and administer this document that the individual can use when they're feeling suicidal as a way to get them help quicker. The last piece is school district policy updates. These are aimed at prevention of adolescent youth who exhibit warning signs of suicidal ideation by providing them help. Current efforts are currently underway by places like the Trevor Project, which go to schools and teach them and give them guidance on how they can update their policies to be more inclusive of everybody, as well as giving them a framework of where to start. So how will we evaluate these methods that are put out there? First, for the FACTS training, we could have a pre-test and a post-test. Then we could also do community-based surveys. These could be sent in the mail or done online through social media. The next piece is to use focus groups. This is focus groups on parents, educators, providers, and the affected population. Lastly, and most importantly, is gathering local public health data before and after the community intervention. This will tell us a lot to see if we've made a difference. So here are some potential challenges or barriers that we foresee coming about. Firstly is buy-in from local and state elected officials. That's why this presentation is so vital, because the education and information in the public health data is really the only way to persuade the local and state elected officials on the importance of this issue and supporting it. Also, getting funding for continuous education and media awareness on the issue so that even when the interventions are pushed through, continuous support can go because of funding. Lastly, getting community providers, so this would be primary care, specialty, as well as mental health providers, along with the school districts to talk to each other and collaborate on action plans on what to do with this issue. Lastly, I want to go through the logic model on how these community interventions will be carried out for solving this public health issue. For starters, we have our inputs, which are our resources needed to implement the intervention. For example, community-wide data on the specifics of suicide rates among youth adolescent females would be vital. Public health outreach and engagement in the community on the issue is also important. A community-wide media campaign, which would comprise of social media, radio, television, and the internet, would be just as important. Additionally, we would also be looking at policies around the issue, sources of funding such as grants, and a teachable curriculum, along with community stakeholder support to enforce these inputs going forward. The activities section looks at the proposed interventions that will be used to achieve the result of driving down the suicide rate within the youth adolescent female population. So this is the facts training, the crisis safety plan, and the school-wide based prevention policy updates. Our outputs would aim to identify the results of the intervention. So for the facts training, this would result in awareness of the issue and how to identify it. The crisis safety plan will result in the creation of the crisis safety plan and its usage. The school-based suicide prevention policy will lead to an actual prevention policy for schools on the topic of suicide, which incorporates training, prevention, and response protocols to the issue. The outcomes section will look at the immediate change that one would expect from implementing these interventions from the start. This would be awareness on the issue, what to do about it, and what the appropriate response is. The impact then, going forward into the long term, would be to see if these three interventions that we're proposing would lead to an overall decrease within the suicide rate among the adolescent female population based on collected data from the local public health department. This would be that before and after that we talked about in the evaluation stage. That being said, do you have any questions? Thank you so much for your time.